all sorts of experiences about their lives online. The conversations that happen online oftentimes mirror those held offline, including in some instances, words of pain. Stephen Miller lost a close friend to suicide, and he lives with that loss.
And then I remember seeing on his Facebook post that he said, it's too heavy, it's too hard, I just can't do it anymore. And I remember feeling that it didn't feel right, but kind of pausing and not really knowing what to do. And I remember thinking, man, I'm gonna call him tomorrow.
Stephen never got the chance. Many of us don't know what to do when a friend makes comments like these on social media. Facebook wants to change that for people using its platform. Facebook has teamed up with academic researchers at the University of Washington, Forefront, and NowMattersNow.org, as well as the National Suicide Prevention Lifeline and Save.org, to enhance the support and resources that are available.
The reality is that a lot of people are posting, not just the pictures of their kid's birthday party. They are also posting things, that they're experiencing real pain and that they are suffering. And so social media provides an opportunity to engage people who are in that place of suffering and pain.
So you reach out to that person and you express compassion and concern, and you practice non-judgmentalness.
Realtor Carrie Simmons had just finished an open house and was checking Facebook when she saw a post that stopped her.
At the top of the postings was a posting from a friend of mine that I went to high school with that said, I want to thank everyone who tried to help me. And I knew right away it was a goodbye message.
Carrie called a mutual friend who worked with authorities to locate the person who wrote the suicide post. In order to turn more potential tragedies into stories like Carrie's, Facebook is taking steps to make suicide prevention resources easily available to those who need them most by updating its support tools in collaboration with mental health experts.
We've tried to lay a really strong academic foundation where we talk to multiple clinicians, multiple suicide prevention experts, and have them vet the product that we've created to make sure that they feel comfortable with it.
When someone reports a post they are concerned about to Facebook, a trained team reviews the content and may provide tools and resources to both the reporter and the person who wrote the troubling post. Tools range from connection to a free, confidential chat line with trained helpers at the National Suicide Prevention Lifeline, to a set of self-care tips that can help people take a break from their emotions, to a help guide and other resources for a friend to support someone who posted something about suicide.
From the design side for the suicide prevention experience, it was really important to understand that people in these situations are in a lot of distress.
Perhaps most important, from the get-go, people with what is called lived experience around suicide have been involved with developing these steps.
And I can't tell you how much of a difference it made to put the messaging in front of attempt survivors and have them tell us what they thought of it.
It's been amazing, actually. I was able to go in and see and interact with the project. The best thing that a person could say in this situation, in my experience, is that they care, that they love you, and that they're concerned.
And by working with the academic community and suicide survivors, Facebook has learned its connections have even more value in a suicide prevention context.
One of the first things that Forefront taught us was that one of the things that really improves outcome is increased social connectedness. That's what we do, is help people connect and help people interact.
Connecting with a friend when they are struggling can make all the difference.
Anytime somebody posts anything on Facebook or social media that's even kind of questionable, I instantly private message them or text them or reach out to them, say, hey, are you serious? Is this, do you want to talk?
Everybody has the responsibility to be there for their fellow man in whatever way they can. And it is sometimes asking the hard questions is the most loving, supportive thing you can do, even though it's hard.
friends out there. Health and Society Scholar. Do I see any friends out there? Well, technology is about 92% helpful in this case, so I'm happy to be able to be with you here from Seattle, Washington. Sorry, it's not a perfect connection or perfect video player issues there. So I didn't prepare a formal presentation on PowerPoint because I figured I wouldn't go on too long, and that I'm here with you remotely. But I did want to have this opportunity to share with you some of my experiences working with Facebook. So I should just say that, as Merlin said, I'm an associate professor at the School of Social Work at the UW, and I study health policy and mental health policy in particular. But my life was changed forever in 2011 when I lost my husband to a suicide. And I basically changed my professional career overnight to really look at suicide prevention. And so that's what led me to co-found Forefront. And Forefront has been very proactive in a lot of policy work in the state of Washington around suicide prevention. And the whole idea of Forefront is to look at whether we can meaningfully reduce suicide rates in one state and then help other states with also have high suicide rates, reduce suicide rates. And so public policy is really a big part of what Forefront is doing. And so about a year ago, we were approached by the company Facebook, the social media giant Facebook, and they really liked our proactive approach to suicide prevention and asked us if we would partner with them to develop suicide prevention tools for use by the company. And so I'm very pleased, to be able to talk about the fact that suicide is a major, major population health issue. As many of you probably know, suicide is the 10th leading cause of death in this country and the second leading cause of death amongst youth. So only after traffic accidents, we have got suicide as the second leading cause of death amongst youth. And I like to refer to suicide as the worst possible outcome of a behavioral health disorder. So 90% of those, roughly 90% of those who die by suicide had a behavioral health disorder at the time of their death. And yet the US Surgeon General talks about suicide as our most preventable form of death. And we're doing relatively little about suicide compared to other diseases of equal magnitude. And it's a really important public health problem because there are many social determinants of suicide and the correlates of behavioral health disorders and help-seeking behavior. So social media and suicide is typically, when you think about it in the press, in traditional media, oftentimes we talk about suicide, social media as a risk factor for suicide. We hear about examples all the time, for example, of cyberbullying or of public humiliation on social media and how that can actually be a triggering event to people choosing to end their lives. Less often do we talk about social media as a potential protective factor in mental health and emotional health and in suicide. And so, for example, social media and Facebook's specific mission is around connecting the world. And we know that isolation is a risk factor for behavioral health disorders and for suicide. And yet social connection, on the flip side, and connectedness, which is one of the main goals of social media, is a protective factor. And so to the extent that social media can be used to build social networks and to enhance social connectedness, it has the potential for good in a population health realm and suicide prevention in particular. Also, social media has the potential to provide resources to those who are in need of help. And also, for those who are isolated, I'm sure probably many of you have had the experience in this room, people who are isolated, they often express their pain on social media. So that's actually a positive thing, that there's a platform out there where people can actually express a desire or a need for help or express pain. So I guess through that lens of thinking about the positive ways in which social media can be used as a potential intervention in population health, that's really where the work with Facebook started, again, roughly about a year ago. So as you saw from the video, Facebook offers through the partnership that we developed, we basically developed a set of tools for people who are either at risk for suicide or who are concerned about somebody who is at risk for suicide. And so basically we offer a lot of different resources. For example, direct access to the National Suicide Prevention Lifeline or the chat line, specific language for how you can reach out to somebody who you're worried about, even some self-help tools for how to deal with emotional pain for those who are at risk for suicide. And then some people are not aware, many people are probably not aware, but Facebook actually monitors posts that are, and I shouldn't say monitoring, monitoring's the wrong word, but they have a teams that work around the globe 24/7, so that if anything appears on Facebook that anybody is concerned about, not just suicide, it could be pornography, it could be cyberbullying, you have the opportunity to notify Facebook and they can take a look at the post and actually take it down. So there's quite a bit of resources that Facebook has put into place and are trying to be more proactive in this space. So I would just say that so you saw what some of those resources are on the video. I would say some challenges to doing this work with Facebook. First off, they have billions of users around the globe. And they get a lot of people just basically reporting posts all the time. And I don't want to reveal the numbers, but the company is willing to reveal them. But they get lots and lots of people reporting posts that they want taken down. And to be able to respond to that many posts around the globe is a very big challenge for them. So there's kind of this tension between wanting to offer support and help, but not wanting to make it so accessible that they literally are being flooded with requests for help all the time or concerns all the time. So that's an issue they face. I know, and they also face, as Merlin brought up in the beginning, all the concerns about privacy. I mean, they walk an extremely fine line. They definitely are not, for example, in the suicide prevention world, we'd probably like them to be more proactive about, for example, looking at posts that have the word suicide in them proactively without them having to be reported by somebody who sees a post of concern. And the company is very reluctant to do stuff like that because of the concerns about privacy, to sort of more proactively look at posts based on language that appears in the posts. So that kind of thing, they're very walking a very fine line around privacy issues. They don't want to be, in a sense, too proactive because they don't want to be perceived as kind of big brotherish. And so then I would just like to say a little bit about the next frontier in this work. So Facebook has launched their suicide prevention tools that you saw in that video throughout the United States, and they're looking at how to adapt these to be culturally competent in other countries around the globe. And I think another big issue is they need to provide education, really, about the tools that they have, but again, without kind of flooding themselves with too many concerns. And the public needs to have better awareness of how to utilize social media to help friends that they're concerned about on social media. I think another big piece on the next frontier is after a suicide death has occurred, there's a lot of concerns about suicide contagion. And on social media, like oftentimes a way in which people will memorialize somebody who's died by suicide is by posting a lot of damaging information on social media around the death and anger and expressions of pain that can be very constructive, but also need to be monitored very carefully. And so we're working with Facebook in this next stage to really look at, in the event of a suicide death, when social media becomes a vehicle for kind of memorializing that death, how do we provide support and resources to those who are surviving suicide and minimize risks of what's known as suicide contagion? So I think that was kind of the main points that I wanted to share. I would just say it's been a really, really interesting collaboration. I think we've learned a lot from each other, us on the academic side and Facebook on the industry side. And I do think that Facebook is working really hard to set an industry standard for social media in general, for like how to interact, in the suicide prevention space. And they also work on other social issues besides suicide prevention. They're working very proactively, for example, on cyberbullying is another example. So anyway, I'm available for questions, but thanks for listening to me from thousands of miles away.